Hello, I'm Dr. James Padilla with the Advanced Medical Academy, and welcome to the Quick Start Guide, Secrets to Building a Successful, Functional, and Integrative Medicine Practice. I want to thank you for spending the next 20 to 25 minutes with me going over some of the highlights of this Quick Start Guide. So it's not a comprehensive webinar, but more of an overview of how to incorporate integrative and functional medicine into your practice. For the full version, we're going to give this to you free, and I'm going to tell you how to get this at the end of the presentation. It's a 40-plus page document on everything of incorporating functional medicine into your practice. But before we move on, I want to let you know that I want to give you a disclaimer that you need to check with your own board, your own state in regards to some of these practices and principles of practicing functional and integrative medicine in your state. In addition, I'm going to assume that you've already been educated in functional medicine, that you've taken some formal course and you know the ins and outs of practicing functional medicine. Now, this Quick Start Guide came about for a variety of reasons, but the main one is that I wasn't fully trained early in my career on functional medicine. And I looked at the internet, I called colleagues, I did everything I could to find out more about functional medicine. And what I found out was there wasn't a lot of formal training out there. I did settle on one course, and it was a 6-month course, which gave me the basics of functional medicine. And within a few months of starting to implement some of these into my practice, some of the principles into my practice, I really started to see a spike in the types of patients that I saw. And I started to grow my practice as a result of offering these new methods of functional medicine into my practice. I was so happy with it that I did contact the company that I took the course from, and I gave them a great testimonial. And with my permission, they put it on their website. And within about 4 weeks, I'm getting calls from all over the world on how I brought it into my practice, how I talked to patients about many different things of functional medicine. And this is really how the Quick Start Guide came about. So just to give you an overview, we're going to talk about how to attract the right patients into your office. Once you get them into your office, what's the paperwork that you use with the patients, and how to get more out of them so you know how to approach them from a functional standpoint. How do you order labs, special testing, nutraceuticals? We're going to talk about once you have all your information that you need in approaching your patient, how do you talk to them about what they need, in addition to how do you collect your fees? And this is probably the most important because let's face it, when it comes to asking for money, it oftentimes makes us uncomfortable. I'm going to tell you an easy way on how to handle that in just a moment. Everything, as I said, is laid out, as you can see from the slide, that we've got a whole 40-plus page document that gives you word by word on bringing functional medicine into your practice. So let's get started here. So the most common thing that I hear as a practitioner is, how do I attract the right patients in my office? And let me tell you, I have tried just about everything. I've spent thousands of dollars on advertising, print ad, I've hired consultants, I've did many different things, and I got to tell you, they've had some success, but not a lot. The number one way that I brought patients into my functional medicine practice was from my existing practice. Now, I know that kind of sounds cliche, but I got to tell you that it works. The number one way to do this is through education. Let me give you an example. Mrs. Jones, I noticed that on your intake form that you did put on there that you had high cholesterol. We call that basically a high lipid profile. I also noticed that you only had a basic test on that. Did you know that there's a way that we can look at this in much more detail and give you your risk factors? Not only give you your risk factors, but also give you ways that you can reverse this or deal with it much more efficiently than more than likely than you are now, and this is all without drugs. Although they may be necessary, we may have a way to help you basically improve your health, improve your cardiovascular profile, and reduce your risk. Would you be interested in that? 9 times out of 10, your patient's going to say yes. It's basically we're asking for permission to look a little bit deeper into their problem. And once they say yes, that opens the door to talk about functional medicine. You don't have to give them a dissertation on it, but the basics that entices them to want to know more about functional medicine and to let them know that there are more options out there than just traditional medicine. Now, I'm not against medicine because it is appropriate at times, but I don't think it's a solution to everything. So you're just giving them options. And let me tell you, I've created an extremely successful practice in functional medicine purely by talking to all my patients. One patient turned into 5 patients, 5 turned into 20, 20 turned into hundreds, and it just steamrolled from there. The fact is as you start to get results, as you start to position yourself more as a functional medicine practitioner, your practice will grow, and it'll grow without having to do advertising on radio, paper, or wherever. You'll grow it by the inside out. And you're going to do it by attraction and not seduction. You're not going to seduce them into anything. You're going to give them merely the facts of what you do as a functional medicine practitioner. That works much better than any other type of marketing out there, hands down. And you have to realize just about everyone is a candidate for integrative or functional medicine. And why is that? Because number one, you want to prevent problems from beginning to start with. In other words, oftentimes our problems start off small but eventually get much bigger, and then eventually they go in to see you or another physician because of this problem. So you can approach your patient from a preventive standpoint, and you can also approach them from a standpoint of, now they have a problem, here's how we're going to deal with it. Now, the number one way to know more about the patient, as you already know, is the intake. Now, why is the intake so important? Well, because it allows you as a functional medicine practitioner to look at what other things could be causing this patient's problem. Now, why do I emphasize this? Because this is not any ordinary intake form. This form is anywhere between 8 pages in our short form, 14 in our long form. And it really allows you as a practitioner to get to the underlying cause without even doing any lab work, although the labs are going to be extremely important. Now, this intake form asks vital questions, and as you know, as an integrative practitioner, our health is often a web. In other words, one thing may cause the other and vice versa. So this questionnaire allows us oftentimes to get to the root problem. We call this the all-in-one form. This all-in-one form also allows you to have patients sign your HIPAA compliant form. It allows you to request medical records from other practitioners. It briefly goes over your fees. So although it is longer, you do want to preface your patient and let them know that this form is a little bit longer, but it's all for your benefit. I also want to emphasize that this intake form needs to be discussed with your front staff, because your front staff is going to field questions in regards to why is this form so long? Do I really have to fill this out? So you've got to give them the reason of why this is in the benefit of your patient. So take the time to talk to your front staff about this. In addition, this form allows you that when you do your re-exam or your reassessment down the road, that you're able to compare from when they first started to where they're at from when you do your re-exam. So it allows you to track your patient. This form is extremely important for many, many reasons, and there are options out there, depending on what software you use, that this can also be incorporated into an EMR system. That I'm going to leave for you to take a look at and to investigate. So, ordering labs. Ordering labs and supplements. Let me tell you something. Oftentimes, one of the biggest objections that I get, or at least questions, not necessarily objections, is that my doctor already ordered labs. And you need to differentiate functional labs from traditional labs. Although there's some crossover on these labs, you do want to state that, Mrs. Jones, I see that your doctor has ordered certain labs, and I think those are important, and they do give some good information. But the labs that we're going to order are really going to look at more function. In other words, why is your body doing what you're doing? And oftentimes these labs give us more information so we really know how to treat you, and it allows us to get to the underlying cause of what's going on. They're very affordable, and before we do anything, I will discuss costs with you. Is that okay, Mrs. Jones? And remember, the 80-10-10 rule. 80% of the time, they're going to say yes. 10% they'll say no. 10% they'll be indifferent about it. So it's education about why you're requesting a specific test, what makes it important to the patient. Now, this Quick Start Guide puts together some of the most common labs that we use in functional medicine. We have them all for you. This is just an example that we're seeing on the screen right now. There are many more, and we have them in our Quick Start Guide. And as I said, you'll be getting the Quick Start Guide for free. At the end of this presentation, we're going to end up giving you the details of how to get this Quick Start Guide. So these labs, remember, allow your patient to touch and feel what's going on in their body. It allows them really to see how is their body working, because we're looking at function. So your report of findings. This is probably the most important part of what you do, because you have to get the buy-in from the patient. A report of findings is so important because you've got to really explain to the patient, and this was where most physicians, I'm not going to say fail, but they really don't allow the patient to fully understand what's going on. And I've got to tell you with confidence that every patient wants to know what's wrong with them, whether or not you can help them out, how long it's going to take to get better, what are you going to do, and how much is this going to cost them. And I know most people do not like to talk about fees, but it's so important because you have to get to a patient commitment. So, delivering an effective report of findings. Now, delivering a report of findings is going over these 4 vital questions, and we've laid out in detail the things that you want to say to your client. It's scripted out. However, this is not a script where you have to follow verbatim. You have to put it in your own language, because it has to come out from you. It has to come from your heart, because patients, they can tell that if it's just scripted out and you read it, that they're going to know that it's not from you, and the likelihood of them following your recommendations become much less. So put this in your own languaging of the things that are necessary to cover these 4 questions. Now, charging for your services. As practitioners, oftentimes we don't want to talk fees to our patients, and in some respects I agree with that. But you do want to get to the commitment. You do want to get them to the point that they have to understand that these things that you've done for them, the assessment, the tools necessary, the labs, and of course relating it to their condition is so important to their health that it will have a vital role on longevity, on how they feel, and many other factors in regards to how they make their decisions. So you've got to talk about basically what are the costs of your fees. The fact is, in my opinion, I think it's more of a problem if your patient has a disease that you can help and you let them walk out the door because you're afraid to talk about your fees with them. Now, there are ways to do it appropriately. Again, you need to check with your own state board and your regulations that is appropriate, but in my office when I was practicing functional medicine is that I laid down what I was going to do week by week. I laid down the charges week by week. I laid down the charges of the fees of the labs and any other costs involved. And they saw what it was going to cost them from point A to point Z. And I came up with a dollar figure at the very end of all costs of everything involved. And I gave them a 10% discount if they paid for it up front. Now, some states allow that, some do not. Please check with your own state board. So remember, 80-10-10 rule, 80% of the time my patients followed my directions. But it doesn't mean you're inflexible. What you can do is you can make payment options for your patients. In other words, once they laid out the whole plan, they looked at the whole cost of it, you can break the cost down for them so you make it convenient on a monthly basis. Typically, I would not let it go more than 3 to 4 payments in order to pay the cost of your fees. However, that's for you to figure out with your patient. However, in our Quick Start Guide, we give you the different options that you can use in your practice. We even tell you what to say and how to say it in order to get to that commitment. Remember that this is not a cookie cutter approach, but one that you have to modify for your own practice. Now, as promised, this Quick Start Guide has all the information that you're going to need in order to incorporate at least the basics of functional integrative medicine. If you contact us at 888-747-8247 and mention that you listened to this webinar, we'll give you the Quick Start Guide for free, or email us at info@advancedmedacademy.com. You'll be glad you got this information. We'll be happy to field any questions that you may have as well too. Please look at our website also for our courses in functional medicine, bioidentical hormone therapy, nutrigenomics, and the list goes on, in addition to our webinars and seminars that are held monthly across the U.S. I'm Dr. James Padilla. Thank you for joining the Advanced Medical Academy.